Good afternoon. Hi, Philip. How are you?
Hey, good afternoon, Christian. Thanks for hosting.
Great to see you and great to have you with us this afternoon. Good afternoon to all our guests joining from around the world. As always, welcome. For those of you who've not joined us before, welcome to SportWorks Talks, an opportunity to share and inspire through the knowledge and sharing learnings from within our great SportWorks community. Today we've got Philippe who's going to give us a great presentation towards more active and healthy cities. Quite a topic of conversation at the moment, and I think it'll be some really good insights looking forward through the current situation we're all facing with the current crisis. A little bit of housekeeping before we get going. So the presentation will run for about 20 minutes, and then we're going to do about 20 minutes of Q&A or thereabouts, and try and get through as many of your questions as possible that you have. In order to put your questions up, please just pop them in the chat. We will do our best to answer as many of those as we can. And if we can't get to them, we'll obviously put all these up on the discussion forum, which will be available for everybody after the presentation. So, enough from me. Philip, great to have you with us. And please enjoy the presentation. Greetings from everyone around the world.
Thank you very much, Christian, for hosting me, and good morning, good afternoon, or good evening, wherever you are. The theme and the focus of that presentation and discussion really comes out of 20 years of experience in the world of sports, major events, but more and more also with a focus on physical activity and quality of life and urban planning. And today, as you said, Christian, the COVID crisis put the whole thing into perspective. So I'll of course connect to that context. I'd like to say hi also to some of my colleagues from the Evaleo group, because we've worked a lot on that global active city standard that I'm going to discuss, and we possibly have a few of our partner cities joining us today, and also my colleagues next door with Blue Shift Group. We're working on some quite exciting projects in sustainability and sports. So Christine, I don't see the deck right now to move. There we go. Thanks very much. So, hey, yeah, this little bug came up and is causing quite some trouble in the world of sports and in all our cities right now. So that's the menu for these 20 minutes. I'll say a few words on that very rapid urbanization process, stating the obvious, but also focusing on some of the challenges, especially in terms of sedentary behavior and lifestyle. We had to go confined, and that has a lot of consequences on quality of life and well-being, which brings the need to move as an urgent recipe and medicine for all of us around the world. I'll talk about this setting-based approach and mentioning the big framework at an international level, going down to a city level, and then focusing on some specific areas at a micro level, including schools, campuses, workplace, because these are the places where behavioral change can happen. And we'll conclude with a few implications or thoughts for cities and the way we manage cities today, and the implications for the world of sports, because that's the community we're in right now. And of course, there's a lot of questions up in the air now in terms of repositioning sports and sports governing bodies in the face of COVID and the consequences of COVID. So as we talk about these different topics, of course, it's good to refer to a bit of a framework. And of course, the Agenda 2030 is an excellent framework to look at some of these specific objectives, namely number 3 and number 11, sustainable cities and communities, and the promotion of good health and well-being for everyone. But of course, my little spin usually is to add number 18, which is of course a little known, especially don't tell please the UN that we have added this afternoon, number 18. But of course, physical activity and sport is very well connected to a number of the SDGs, and today's discussion is a clear illustration of that. I would like to briefly mention that quote from Mrs. Brundtland, who, as you know, is a bit of a mother of sustainability when she handed her reports in '87 to the UN, which led then to the first World Summit, Earth Summit in Rio. Interestingly, not everyone knows that Mrs. Brundtland was also the general director of WHO at the time of the SARS virus in 2003, and I find that quote quite interesting from her because it underlines the necessity to consider public health well-being as a bedrock, as a condition for any sort of human development and economic development and environmental security as well. And that, I think, comes quite clearly nowadays after 2 months of confinement. The world is going urban, that's stating the obvious, but I've put a couple of numbers there because we are nowadays pretty much around 56% of the world population in cities. And the urbanization process is going very fast, especially faster in some parts of the world, especially in Africa right now, for example. We expect between 2/3 and 3/4 of the world population to live in cities by 2050. Now, there's nothing bad in living in cities. The problem is accessibility to active and healthy lifestyles, accessibility to basic services, to healthcare, but also to clean air and clean water and public parks to enjoy movement and physical activity. And the number of mega cities, that is 10 million people or more, is exploding and growing very fast. And we expect by 2030, 10 more mega cities in the world, and 9 out of these 10 will be in developing countries. So the challenge of fast pace global urbanization is even more acute in the developing nations. And just one fact for Africa, the continent is going to have to digest 1 million more people in its cities. So imagine again the challenges that means for the quality of life of people. So we are going urban. Pollution is a major issue in a lot of cities, air pollution, water pollution, but also lifestyle issues, a rapid shift in nutrition habits. And you see here images of a rapid and sad shift in nutrition. For example, in Africa, where the number of cases of obesity and diabetes is exploding, whereas we were used to talk about undernutrition, but now there's more people around the world that are dying of obesity and consequences of obesity rather than undernutrition. And of course, we live in a digital world, and that's fabulous. Our kids can access a world of knowledge within a click or two, but the thing is they don't move enough, and we have too many couch potatoes nowadays. So cities obviously are the places where we live, and the way we design cities, the way we operate cities has got to change. And there's a lot of people that are thinking or rethinking the way we design and operate our cities, the way we can work together and have a more human-centered design to really understand the basic requirements of people to live in cities. Just a few more numbers now on the public health challenges, and you all know that the world lacks physical activity in sports, but some shocking numbers, for example, the fact that over the last 40 years, the number of kids and adolescents that have become obese has been multiplied by 10. Obesity is fast growing everywhere. In the States only, we're talking about 300,000 people dying of obesity and consequences of obesity. And recent studies back in November, I believe, from the Lancet and WHO showed that more than 80% of teenagers 11 to 16 are not meeting the recommended level of physical activity by WHO. So that's very concerning for parents like myself and for our public bodies when you think of the lifelong consequences of lack of physical activity at a young age. So sedentary lifestyle and overweight as a condition brings more non-communicable disease or chronic diseases, so diabetes, high blood pressure, cancers, etc. And it brings also social exclusion, health costs, because the health cost is exploding in our societies. But it means also lack of productivity. It's a very heavy social cost for our societies. And of course, now came also the virus. So you may wonder, okay, what's the worst enemy in that context? Is it fast food, soft drinks, sedentarism, or air pollution and traffic, or is it this bloody bug that we inherited a couple of weeks ago? It's quite interesting and maybe an inconvenient truth to look at the annual death toll of air pollution. More than 8 million people, 8 million people dying of tobacco every year. And I call it the silent pandemic of overweight and obesity, which is estimated to kill 2.8 million people a year. These numbers are not just coming off my hat, they come from WHO and some of the most recent studies. And I may add COVID at the bottom, which at this stage has apparently caused the death of 250,000 people. Of course, sadly, still counting, and we'll know more in the coming months of the more accurate numbers. But it just puts things back in perspective a little bit. But of course, we know that we need more physical activity, better health in our communities, and there are physical activity guidelines in most of our governments. Here is an example for the US. The problem is, how is that implemented to be in a better position to face the next public health challenges that are surely going to hit, be it a virus or environmental crisis and big heat waves, for example. So what are some of the lessons over the last couple of weeks linked to this COVID-19? One of the lessons is air pollution is one of the major contributions to complications and death linked to COVID. The more exposed people are to small particles over a long time, the more likely they are to finish in emergency services, and the more risk they have to die. And these are not just newspaper articles, but serious studies coming out from different corners of the world. Interestingly, this map on the left-hand side from Fitbit dates back March, but shows a drop in physical activity of those using these equipments. And more, of course, will be analyzed and known in the future. And it's interesting because we hear from some places and cities in the world that more people than ever actually are enjoying walks and runs in the parks, but at the same time, some very harsh confinement policies meant that a lot of people just couldn't move more anymore, and there's definitely been a massive drop in normal regular physical activity around the planet. Another thing we discovered over the last couple of weeks is that a large majority of those that ended up in intensive care had one, two, or more chronic diseases, and a lot of people with obesity and overweight. And look at these numbers on the left-hand side for New York. More than 88% of the people getting into emergency services had more than one chronic disease, and then you have the list here: hypertension, obesity, diabetes, cancers, etc. So even the WHO rapidly came up with a list of recommendations and measures to really highlight these issues and link between non-communicable disease that are essentially lifestyle diseases and COVID, which is definitely having a high toll on people already suffering from these lifestyle diseases. Very interesting study from the North showing that even during this coronavirus crisis and pandemic, it's very important to maintain as much as possible physical activity, cardiovascular capacities, and muscle strength. So they recommend once again this regular physical activity as a way to stay in shape, to have a better immune system, and to be better prepared to face illness if you are hit by the virus. And interestingly, the last line on that the conclusion says regular physical activity is important in the prevention of severe complications in any future pandemic viruses similar to COVID. That's a very clear message for our policymakers and decision makers for the future in terms of being more resilient and better prepared for the next hit. The European Association for the Study of Obesity also came up recently with a position statement highlighting the link between lifestyle, sedentarism, obesity, and COVID. So there's a number of key lessons from a public health domain that are very important to understand now for cities, but also for sports organization, as we will see with the concluding remarks to open up discussions. Now, interestingly, cities have been quick to adapt to this crisis, and in order to respect social distancing and to promote physical activity and movement, a lot of cities have built up some temporary bike lanes, and there's a strong move to actually keep these after the lockdown, and a lot of debates around the world in different parts of the world, different cities, around really rethinking the heavily car-focused design and operation of our cities. So that's going to be hugely interesting to observe whether in the long term there's going to be better air quality, more physical activity, more safety in the streets for those choosing that solution. And of course, there's a lot to learn from some of the people up north, including especially Holland and Denmark. And here you have some very solid evidence from Holland and from the Dutch cycling embassy on the benefits of regular cycling. And these guys are amazing. They recently opened a bicycle station on several floors, which is entirely devoted to parking your bicycle. So it's definitely time to act, and it's time to move individually, collectively, and for city leaders and government leaders. So where do we start? Physical activity is an amazing medicine, and it's a cheap medicine actually. So it's been linked, and there's evidence, mounting evidence. It's linked to a number of physical health benefits and also mental health benefits. You see here example of positive impact on cognitive decline, depression. Sports and physical activity just makes you feel good and build up your self-esteem and confidence in life, and give you better perspective in life. And it should be a right for every child to be able to move, to enjoy the beauty and the values of sports. But sadly, it's not the case everywhere. An important consideration when you decide to invest more in physical activity and sports for all is to understand the inequalities in physical activity. And of course, people suffering from physical disabilities are less active, and it's not just linked to their disability, it's linked to the fact that their life is made more challenging in terms of accessibility, physical accessibility to the streets, to transport, to the city in general, but also accessibility to clubs and to be able to practice sports with other people. But also vulnerability from a socio-economic point of view has a direct impact on the likelihood of you being active or not. And we know that those that are at the lower end of the socio-economic ladder exercise less, are less active, and therefore are more at risk of suffering from non-communicable disease. And we keep learning a lot. So whatever the action is taken, I think that decision makers, policy makers should think macro and micro. At the macro level, we have a number of frameworks that are important to consider. I'll cover a couple very quickly. It can be translated into national policies, but it is really at the city level and in the different places where you spend most of your day. So at home, in your neighborhood, at the workplace, in school, or at uni, or in your local club, that things change. This is where behavioral change happens. I mean, the question is simply, will you adopt a more active lifestyle if your government says that you should be more active? Probably not. But if your mates and colleagues and friends are more active around your workplace, that is more likely going to have an impact on you. So at an international macro level, there's the WHO Global Action Plan on Physical Activity that's been designed, the Kazan Action Plan led by UNESCO, UNICEF working a lot on sports for development, and more and more evidence, especially with the great work of the Commonwealth Secretary working with UNESCO and AIC on the matrix, on the actual capacity to measure and show the evidence that physical activity and sports improves people's situation. So there's a move now of urban planners and architects and city leaders rethinking the way cities are designed and making physical activity more the norm, really, for everyone. It's quite exciting to see these recent developments in many parts of the world, and there's a lot to learn from each other. Christian and I right now sit in Lausanne between point 4 and 5 on the map here, and I'd like to show that because there's a lot of really interesting collaboration between the medical world and geoscience as well, with this recent study showing the BMI, the body mass index, and in blue those that have an average lower BMI than the average, and in red those that are higher. And that of course, in essence, is seen in every city. You have areas where people tend to suffer more from chronic disease, lack of physical activity, and overweight and obesity. But interestingly, in this research, they started to control the different factors and indicators, and the statistically significant differences on the map remained, which showed that the way the city is built, the way the urban fabric is designed, has a direct impact on people's likelihood to be physically active or not. So it depends very much on the capacity to walk, to run, the walkability of the city, the accessibility to public parks, but also the peer-to-peer influence and the role models in the community is very important. And at the end of the same lake in Geneva, which hosts the World Health Organization, a recent study by the same team showed the same sort of plotting and zoning of high or low BMI. That's the bottom map, and the top map is quite a replication in terms of the red and blue dots, but the top one shows the consumption of soft drinks, basically. So that if anybody wanted a proof that access and consumption of soft drinks has a direct impact on your BMI, that's it. The reason why I show these maps is because, like a surgeon, I think policy leaders and city leaders have, it is important for them to really understand the fabric of their city and where physical activity and sports should be promoted with the biggest impact and the biggest return on investment. And that's definitely going to influence policy making. A very quick word in 1 minute before I conclude on Global Active City, because this has been a very exciting project over the last couple of years, having worked with cities around the world. We managed to certify in 2018 the first 6 cities, and Lausanne joined a couple of months ago. And you have here examples of Ljubljana, Hamburg, Lillehammer, Buenos Aires, and basically that solution provided cities a framework, a coherent approach about placing physical activity and sport at the core of the city governance. And it's not just a simple list of wishful thinking and best case studies, etc. It's about a management system that places physical activity at the core of the city operations and planning, and understanding the many benefits of physical activity in sports in social terms, economic terms, etc. And the list of requirements imply that the city builds an alliance of different key players, sets objectives, measures impact, correct and improves the situation, and there's an audit at the end of the day that takes place for the city to be certified. So these are the first cities that have been certified lately, and we're still in touch with them, and some of them might be on that webinar, by the way. So a big thank you for them for being pilot cities and testing. And I do believe, based on the feedback we currently have from some of these cities, that having that framework and that alliance of key players within the city put them in a better situation to face a major crisis and to be able to bounce back and to activate the network of different key players within the city to leverage on physical activity and sports after confinement. And more will be learned, of course, in the coming weeks and months. But just to give you an example, our friends in Buenos Aires leveraged on the Youth Olympic Games in October 2018 to accelerate the process to get their people more active and fit. And they had a wonderful set of initiatives with health stations in the neighborhoods, with free checks and preventions for local families, conferences with doctors, pediatricians, and cardiologists to make sure everybody was speaking the same language and approach the city fabric and the social fabric in a coherent way. They managed to bring these different departments around the table like never before, simply because there was this project and this powerful brand that brought people with the same objectives. And I leave a link here for you to enjoy a little snapshot and video of Buenos Aires. So coming to the end, Christian, last couple of slides. Other places where you spend, obviously, or maybe sadly for some, a lot of time is the workplace. And the workplace is definitely an area where there's a lot to do in terms of getting people more active. And the business case is massively important. If you are an employer, I mean, you would be crazy not to invest a little bit of money into having more active, productive people at work. And you see numbers here on absenteeism, on staff morale, on productivity. Liverpool has been one of the first certified cities, and it's been the lead city and partner development cities in the process. and they have been very active on the workplace promotion as well. And the numbers are quite impressive. If you look at the number here on the right-hand side, it says social return on investment for £1 invested is about 15 in terms of quality of life, productivity. And if you need numbers, numbers exist. I mean, there's a lot of studies that have been made. So workplace is critical. Schools are critical, and I move here to Japan. This is an example of a school in Japan, primary school for little kids. We know science tells us that more active kids learn better, the cognitive development is better, the confidence is better, the resilience is better. So very important at this age, and at a later age at university, our friends from FISU, the International University Sports Federation, are launching right now a wonderful project for more healthy campus around the world. They're working with 7 pilot universities around all continents, and working with the same sort of logics and even with the same team partly that developed the Global Active City framework, because the 180 million students in universities around the world are going to be leaders of tomorrow. So the earlier you can embed that active and healthy lifestyle, the better for these guys moving forward. And lastly, the club, the sports club is also an important place where you spend a lot of time, or your kids spend a lot of time. Problem with the clubs is usually there are barriers for people with disabilities or age or obesity or whatever. So it's very important to also rethink the role of clubs. And clubs have been very creative over the last couple of weeks to continue to provide services online, training sessions. Coaches have been amazing in many countries, and we have that feedback from many different places in the world. And I mentioned this project here with the link, Sports Club for Health, which has been supported by European funding, because it's about repositioning the club in the local communities as a provider of well-being and being more open to people with less physical capacities, for example. And the number of physical health benefits, social health benefits, and mental and psychological health benefits is enormous. So again, the business case is there, and it's very interesting for clubs to be repositioned. Last 2 slides to open up the discussion, and hopefully we'll get a couple of questions. But what are the implications really right now in the heat of the action and getting out, hopefully slowly, from the confinement? What are the lessons for cities? A couple of lessons I see. One is to go beyond considering sport as a leisure, a nice to have. Sport is way more than that. Inclusive sports and physical activity can really transform the lives of people, especially the most vulnerable people and communities. And the benefits are enormous in health, in social inclusion, in skills, in academic achievement, conflict resolution, employability, etc. Make your herd resilience stronger. You have all heard about the herd immunity that Sweden is trying to test. But I'm talking here about a herd resilience. So how can you really fight non-communicable disease and promote and invest seriously in active and healthy living for everyone is hugely important now, to be able to better face the unavoidable future crises linked to either virus or climate situation and big heat waves. Make your city fitter for the future, able to bounce back. Think differently in terms of urban design. Think human-centered design. I mean, it's not simply enough to have beautiful buildings and bridges, but it's about really understanding the needs of people and working with the medical world, with parents, with neighborhoods, etc. And bid to host major sporting events only if you can really fit them into the city long-term interest, for people to move more. And lastly, a couple of implications and lessons for sports governing bodies, federations, etc. Position your sport beyond competition and entertainment, just the business side of it. If you want to be relevant in the future and appealing for a young audience and for cities to be able to be willing to host your event, there's definitely a need to understand the major trends out there in consumption, in health, in mobility, etc. And identify the issues and challenges you can help to fix with your sports. Leverage on your sports' unique power to transform lives of young people in particular. Engage with young people and people of all ages and ability, and build up the grassroots participation of your sports. Embrace as much participation as you can, and also include the unofficial urban disciplines that came out of Norway, instead of seeing them as challenging disciplines. Understand cities, try to speak the same language, show that you understand the city's challenges, and partner with pioneer cities to show and showcase and promote how you can best face and contribute to face and fix their challenges. Engage and empower also your best role models and ambassadors. There's nothing like them to harness their inspiration and dedication to change behaviors, especially with kids, and rethink also the bidding process. Search for more meaningful partnership with cities to address the tangible challenges through sports participation and events. And finally, position legacies, the event legacies of your sport as the cornerstone and your raison d'être when you engage with cities. So sorry, I went a little bit over time, Christiane. I'm sure you have a couple of questions, either yourself or some of the listeners. I'll finish with this comment here. I would definitely push for more physical activity in sport than ever, for more resilient communities and cities, and for a solid recovery plans in the coming weeks and months. Thank you very much for your attention.
Fantastic. Great presentation, Philippe. Thank you very much. Yeah, very on topic, and I think some great opportunities and some great insights that you share. I think those last two slides, and I'm going to personally go back to them after the presentation, because you've got some great headlines there and some great takeaways that we can all actively get involved with. So yeah, you're right. We've got some good questions coming through on the chat. Thanks for those. So I'm going to start here with one from Sarah. Can sporting events be useful and give a strong incentive in reaching SDG number 11? To the question.
Yes, they can. Events of different sizes. Major events can, of course, have a major impact. What I have observed for quite some time is really a lack of understanding from the city sides of what an event, a sporting event, truly is, and how it could be leveraged in the years leading up to the organization, to the staging. There's a lack of leveraging, generally speaking, ahead of the hosting in many host cities, in the way they can engage with schools, with local clubs. And for example, I had this experience in Buenos Aires, where in the 3 or 4 years leading up to the hosting of the Youth Olympic Games, 1.2 million kids were engaged through the local schools and clubs to practice more sports, to meet with champions and discover the values of sports and Olympism. These are just a few examples of how an event can be and should be an excuse to do way more and to plan every action with a long-term perspective. But sporting events are the big ones, of course, the very visible one. I think that one of the impacts possibly of COVID is going to push also for low-key, local events, community events that are really bringing the community together and leveraging on the local role models, on the neighborhood role models. So at every size, I think an event can be definitely a great catalyst, but it can only if you have a vision, if you have really the traction and the vision of the key leaders. Otherwise, it just remains a nice pop-up event and a piece of entertainment.
I think that there was the presentation earlier in the week by Guy Horn, where he talked about how they opened up Hong Kong and the use of events, and it was community events, how they opened up the country parks and they used the public facilities, and it really got the city engaged. So using events at a community level was really important to opening up the city post-SARS, which is what we're facing now.
Yeah, and there's of course the psychological effect of hosting the first events that will show people we can do it again. And Guy gave the example of the Madrid game in Hong Kong, which was already like an igniter.
Absolutely, yeah. So I think we've still got to retain that. What's going to be that Madrid opening opportunity? So great, thanks for that one. Next question from Maxim. Do we know enough about active cities? If you had €1 extra to invest, would you put it in more science or more practice?
Very interesting. I would probably split the euro. um, we we need more evidence, and we are getting more evidence. And I would encourage our friends from the current active cities to share more of the recent findings. But at the same time, there's always this push for more evidence and evidence and evidence. And we've seen that again with COVID about the choice of different types of treatment. And some experts in the medical world saying, oh, no, we can't push for this treatment because the evidence is not enough. But when you are in a war zone, you're going to use the more practical tools that work and base your decisions on your experience. So I'm also a great advocate of delivering, testing, having pilots, and immediately looking at what works or not and adapting. So I would really go both ways. In order to scale up, you need the evidence to get more funding, but you need to really put your hands in the engine under the bonnet and really start delivering stuff and see how stakeholders react and what are the impacts. There's common sense management that basically needs to be there as well.
Yeah. So 50 cents in each camp.
Yeah, probably. Yeah, as a typical Swiss looking for compromise. Yeah.
Well, there's a good follow-up question here. So from Frank, in Switzerland, 75% of cities' sport budget goes into sports association. However, only 25% of the population is taking part in sports associations. Being in a sports association could be expensive. Do you think the level of a physical activity could be linked with revenues level? Higher revenues equals better opportunity to practice sports. Complex.
Yeah, thanks for giving me 2 hours, Christian. I think we need a smart mix of the normal institutional clubs and associations that are funded by either the local government or a national system, as we have in Switzerland with youth and sports. But at the same time, we need the recognition that not everyone wants to be part of a club, either because they are ashamed of their body image, or because they don't have the finance to pay to enter the local club or pay for their kids' membership. So we also need to think of these local associations that are not a proper sports club, but offering physical activity and moves, but sometimes in the parks, in the streets, in the neighborhoods. We need to be smart and innovative in the way we give opportunities. Ultimately, we need kids to move. We need everybody to move more. And we need to use smart technologies as well. We need to use smartphones, apps, and different tools, but always thinking about accessibility, because it's never going to be the same for every groups of people. I mean, I hear a lot of my friends and people saying, oh, it's great, I've never seen so many people running in the parks or in the woods, fantastic. But at the same time, it's looking at a specific community. There's other pockets of population that have been hit badly because they were sedentary already and are even more sedentary today. So again, I would really stop thinking only institutional structures and clubs and federations, but think very openly to embrace all sort of new practices.
Yeah, I mean, it segues nicely into this next question, which is, thanks, Philippe, very interesting and thought-provoking presentation. Is there any good practice of how to engage people who are digitally excluded?
That's an interesting point, because obviously there's always this debate of whether using apps and digital engagement is leaving part of the population aside. And basically, first of all, I would say that we would be surprised at the rate of digitalization in some countries. If you look at countries, some of the leading countries are African countries. You look at Kenya, for example, it's quite amazing the number of operations and engagement that is done via smartphones, micro banking and all of this stuff. So sometimes we have these stereotypes and we've got to be careful about that. The same with the elderlies. If you go to old people's house, it's sometimes quite stunning to look at the level of digitalization of grannies and at 90 years old or more. That being said, yes, of course, even recently during this confinement, homeschooling showed very sharply that some families and kids were disadvantaged because they don't have all all these equipment and connectivity and good bandwidth, etc. So it proved to be a challenge for a number of people. So again, I think it's a question of balancing the embracing of new technologies to reach out to people who would maybe never otherwise show up at the local club, but at the same time, for other parts of the population, it's about getting down their house or getting a role model to go to their workplace or to the school and taking them by their hand and moving to the park to actually play a game and bring the balls out and enjoy sports. So there's no one single solution. I think the best solution, those that are reaching most people, are really a mix of these digital or non-digital solutions to engage and embrace all different pockets of population.
So a holistic approach, very much so.
Yeah, I know, for example, our friends in Liverpool are really very advanced in understanding the barriers to physical activity for those that are deprived or suffering from different chronic diseases and socially isolated. So they're really engaging and working with the local communities, with the local leaders to actually knock on the doors of these guys and take them out. It gets down to this point of really going to where people are. It's very challenging. I mean, there's no single solution by definition in getting people more active and changing behaviors, because every individual situation is by definition very personal.
Yeah, that's good. It's good to have that perspective. So a question here from Paulina. Firstly, thank you, Philippe. I am inspired once more. There are several approaches now concerning the impact of COVID on the world of sports. Do you think the economic consequences will have a negative impact on the global sports for all movement and leisure sport, with the risk of getting left behind? Or do you see it more as a chance to fight the commercialization of sport and refocus on the social and health benefits? A great question, Paulina.
Yeah, great question. Thank you very much. What can I say in 30 seconds? you can look at this.
We can go a little bit more over time. It's fine.
Yeah, thanks. No, but you can look at the half empty or half full glass, basically. And there's, of course, different views being expressed right now. Those that really think that the financial situation and the cash flow will be so challenging that we're going to lose some clubs, associations, organizations. And I have to pay tribute here to a number of cities which have actually started to open up dedicated envelopes and billions to fund some of these organizations that are lacking cash flow and have no more entry fees or membership fees coming in. And more than ever, this tissue, this fabric of social players, local clubs, associations is going to be important to generate social capital, social dividend, and that's an important point. So I'm on the side of the half full glass. Sorry, I would look at this opportunity as an opportunity to bring more meaningfulness and more impact to the world of sports, and to kind of reprogram and educate our public policymakers and decision makers as to the role of sports and contribution of sports and physical activity for all, as you've seen on a number of different elements in life, be it health or access to education or social inclusion. We've been working here with a program with young migrants, and it's been fantastic to look at the effect of being included in a regular sports practice, meeting local people. Sports is just, as I said, it's an amazing and cheap medicine. So I think there's opportunities for a lot of sports players to reposition themselves, to really shift and engage with their public bodies in a different way. There's an opportunity for professional sports to become more accountable, more responsible, and therefore more appealing in the long term, because they would engage also with the big money makers, the big players, and even with their sponsors to bring more contribution to society and to the local key players. And we see, again, wonderful initiatives. I think today or yesterday was news of Paris Saint-Germain, where the players and the clubs provided some food, because there's actually lines up of people trying to get cheap food because they can't even pay the bill at the end of the month. There's examples in Hamburg and other places of clubs offering their services with athletes going to the groceries for elderlies who can't go anywhere. So there was a sense of solidarity also recently shown by the sports community, and hopefully we can really bounce back and gain relevance in the eyes of policy making.
Yeah, I think it's, as you say, we've got the opportunity to perhaps look at some of the behaviors that we've established and evolve some of those behaviors through the current situation. Unique opportunity, as you say, to look at the glass half full. So we've got time for one more question I'll pop in here now is, so this one's quite specific. It's regarding the strategy you are considering to persuade governments like Mexico to join the Active City program when sports is not in their priorities. I guess that Mexico is probably not to single out a country, but I guess you're facing that with many countries where sport may not be the priority of the national or the regional guidance.
Yeah, and that's an interesting case and example. Thanks for that question, because sadly, Mexico is top of the charts when it comes to diabetes and obesity, with a couple of other countries and neighbors. It's hard to say really what ignites change. Sometimes it boils down to one or two person with visions and balls. Sorry. Sometimes it boils down to just one politician. But very often it's rare to see that level of vision or ambition at a national level. It's more common to see that vision showed up at a city level or a community level. So once again, back to a previous question, I think that the more evidence we have, the more case studies, the more examples we get from the current positive stories unfolding in global active cities and any other active cities, because it's just one solution, this framework we developed. The more evidence is being built and is being amplified by big organizations, UN agencies, and all the rest of it, the more the global governance will pay attention to sport as being more than entertainment and business. That's what's making me so angry so often, is that sport is really put aside as pure business and nice to have. And we still have a long way to go to really build up that link between the sports community and simply the way we talk about sport. As soon as you start saying the word sport, there's all this connotation and ideas that you're talking about elite sports, about competition, etc. So that's why I'm always carefully saying sport, physical activity, movement, an active game when you think of youth in particular. So again, many years to go to convince more decision makers and politicians, but hopefully the current crisis may accelerate this awareness that movement, we are designed to move. Sorry, I'm not making any ads for any brand. We have been designed to move, but we forgot about this, and our kids have too much screen time. It's time to move. It's time to change, not just as parents, but as city leaders as well. It's time to really put bikes first and cars second. That's just one small example. And to work with employers to build up this alliance of key players and to act at a local level to change behaviors. Because next time around, we're going to be better prepared to face such pandemic and to bounce back.
Yeah, I think on that point, I'm going to say thank you. The bring it back local, keeping it simple is such a great key message. Look, I know there's some great questions still in the thread, and just to clarify, we will come back and answer those through the discussion forum. Philippe, is there any last comments you've got you wanted to add in order for people to perhaps look at how they can do that on a local level, how they can do that wherever they are around the globe, to initiate those first steps into getting moving?
Well, as soon as your health ministry allows you to do so, put your sneakers on and get grandma or grandpa out in the park for a good walk, a good run, and see whether you or some of your friends can be role models in your community, in your neighborhoods. really get to meet people, take them out and enjoy movement and sports and fresh air. That's the best thing we can do to build up our immunity and our happiness.
Great. Well, on that message, that's a wonderful parting message. I want to say thank you for joining us. Thank you for sharing, your depth of knowledge on this topic, and the motivation and drive you have behind it as well. All credit to you and the teams you work with in making this an important priority for us all. So I want to say thank you very much for that. To all of our participants who've joined us from all around the world, I want to say a big thank you to you as well. Without you, we don't have these presentations. It's just me and Philippe sitting in a room chatting with each other. So it's great to have you with us as well. And on that note, I want to say thank you very much. And
thank you. Bye, everyone.
Bye, everyone. And I wish you all to stay safe, stay healthy, and get out and walk as soon as you can.
Indeed.
All the best. And bye for now.
Cheers. Thank you.
Cheers. Bye.